Hey everyone, thank you so much for joining us today. We're very excited to introduce our new Meet the Sponsors Summit webinar series. Our goal is to give you an opportunity to hear from the sponsors that will be at the conference and ask questions. We have two sponsors for you today. The first one is Code Technology. Please allow me to introduce Mary Olson, the Director of Business Development. Mary was born and raised in Minnesota, but now calls Myrtle Beach, South Carolina, her home. She has over 30 years of healthcare sales and account management experience, working with organizations such as 3M, Spinal Designs, Corporate Advantage, TVRC, and Code Technology. Mary, how are you today?
I'm good, Lance. Thanks for having me today. I'm pleasure to be here.
Absolutely. Glad to have you as well. Shall we get started with our questions?
Absolutely.
All right. Can you give us a brief overview of your company and what problem you solve for physician groups?
All right. Well, first, we don't need another acronym in healthcare, but I got one for you, and it is our company name, and it's CODE. CODE actually stands for Clinical Outcomes and Data Engineering. So really what we are experts in data aggregation, data collection. That is what we do. That is what we solve for organizations. So we're your best partner when you're looking for someone who is going to collect and utilize outcome data for many of our organizations that believe they can implement internally. And I'm sure, Lance, at Meriplex, you and your team understand even just some of the technical and requirements that go on just on the IS and IT side. We take care of all of that for organizations, not just that part, but also we bring the humans. So we bring humans that allow us to remove FTE requirements, full-time equivalents at the healthcare system, get to focus on the patients, not on collecting data. So that's what we solve. We bring the team of people to your organization to collect data. And then our goal is to make sure through this collection, we help you use the data, use it for good, and then ultimately love it.
That's a great answer, Mary. I love that. Thank you. So let me ask you this one. This is the challenge. Why should attendees be really excited to meet you at our event?
Well, I'm going to give my little self a pat on the back. I'm fun. I'm just fun to have at conferences. The whole CODE team is fun. We're fun to work with. And not only do we take data so seriously, we're just fun to have a great team, fun to be around. So anyways, back to first, I want to say how thrilled I am to be able to come back and be at the Meriplex conference. Last year was my first. So I'm very excited to return again this year. You guys have a great group. It's such a well thought out organization as far as how you deliver great services. We are the same. We feel like we have the same mission. Now, why should your attendees be excited? There's a lot going on in healthcare today. There's a lot going on data engineering, data collection. Our goal is to be those subject matter experts. We want to be an extension. We want to be that partner that knows what's going on with quality-based programs. What are programs like CMS? What are they requiring right now? So many organizations are getting these programs and don't even know where to begin. So what we're the expert. CMS has another program coming that is going to require hospitals to collect outcome data starting April of 2024. So what do hospitals do with that if they're not operationally set up to do that? We can solve that for them. So we're the experts in data collection. And at CODE, we're not just the application that you can have the data in and see it and play with it and run reports, but we're also the individuals who are going to be that extension to contact your patients. So why should they be excited to talk to me is because we get it. We get data. We get the trials, tribulations, and the nuances that come along with that work. And we have solutions that have been proven for over 10 years of how to do it and do it right.
I love it. That's a great answer and some fantastic information for everybody. Let's see if we've got any questions from the audience for you.
Oh, great.
No questions. I'm not seeing any questions come in. So you got off easy this time, Mary.
I did. Well, I hope we'll bring them to the show in October.
That's exactly right. Well, thank you so much for being here today, Mary. Really appreciate it. For those of you on the call, if you're interested in learning more, please come and attend our summit first, and also follow Code Technology on social media. And it's a great way to learn about their company. So thanks again, Mary. Appreciate it.
Thanks, Lance. Have a good day.
All right, you too. All right, our next guest is Richard Andrews from Health Here. Richard is the VP of Sales. In the role, Richard builds partnerships between Health Here and new customers, manages a team of sales reps, and actively informs company product strategy and direction. Before Health Here, Richard was a senior sales engineer at AppNexus prior to its acquisition by AT&T. How you doing today, Richard?
Great. How you doing, Lance?
I'm good. Good to see you again. Good to see you again.
You too.
Shall we get started with our questions?
Absolutely. Let's go ahead. I'm excited to answer them.
All right, fantastic. Can you give us a brief overview of your company and what problem you solve for physician groups?
Sure. Yeah. Thanks, Lance. So, my company is Health Here, and our mission is to empower the core patient-provider relationship. So, we know that's the bedrock of healthcare. So everything we do is against that North Star. And how we do that is with a suite of solutions. So we are a software company, and we work primarily with medical practices. Orthopedics is our number one specialty. So I know a lot of groups at the Mariplex Summit come from that specialty. So that's kind of our bread and butter. And in terms of what we do is we look to solve today's friction points across the patient journey for practices. But we also look to empower practices looking to move to more value-based care delivery and payment models. So in terms of the solution offering that we have, I think it is unique in the market. I don't know of anyone else who has this set of solutions. We have three main tools, and these can be purchased a la carte or purchased as a bundle. It just kind of depends on what the practice needs as we engage with them. And our initial solution was our intake tool. So that's streamlining and automate patient check-in, highly centered around orthopedic practices and other specialty practices. So we look to capture as much patient information up front before a patient arrives in your clinic. But we also have in-clinic kiosks and tablets for anyone who doesn't do it beforehand. But I will say about 70% of patients check in beforehand with that pre-checked email and text notification. We also have a tool set to empower practices looking to offer their patients more cost transparency. So that's our patient cost estimator and prepayment tool that will allow us to look at your payer allowable fee schedules, your self-pay schedules, and the health plans running through your practice to offer automated cost estimates to patients prior to any services they receive at your clinic or practice. So one that helps offer cost transparency for your patients and comply with good faith estimate requirements. But we also allow practices to move more of their payments from patients prior to actually providing those services. So more of a traditional retail model. So patients often are paying 50 to 60% of their entire responsibility prior to receiving treatment from the clinic. So we're kind of moving healthcare forward in that way. And then finally, we offer a value-based care tool set. So this is our newest set of tools. What this allows you to do as a practice is to essentially own a bundle of services that you then sell into your market and negotiate and adjudicate these types of arrangements with payers. So as part of that, we allow you to manage a library of services and episodes that you bundle up and offer on a prospective basis. Because we work primarily with surgical specialists, these are often surgical bundles, but we do have tooling capabilities to give you the ability to set up non-operative bundles. And then as patients proceed throughout that episode of care, we give you all the tools you need to adjudicate that fund flow between the payer, whether that's an employer or a TPA, to the different providers that participate in that bundle. So those are three core sets of solutions. We certainly are happy to engage with anyone who is interested in one or all of the above. They certainly work the best in concert, but we're more than happy to kind of dig into the details of what we do there once we get out of the conference.
Great. Thanks, Richard. That was a great overview. Really appreciate that. Aside from the fact that you're just a fun guy to have around, why should attendees be excited to get to know you a little bit at our event?
Well, so one thing, as I mentioned, we are highly specialized on orthopedic practices and surgical specialists. So I know that's most of the attendees at this conference are within those specialties. So we have tailor-made a solution for that group. We don't work with health systems. We work primarily with outpatient medical practices. So for one, we're there specifically for the folks who are attending the conference. Two, our solution set is completely unique. I don't know of any competitors out there across those three core solutions that we offer. I know there's some that might offer tooling in one or two of those buckets, but not all three. So we can help practices who want to consolidate all those tools into one comprehensive suite. And then finally, we're still a young company. We've been around about 4 or 5 years, so our product set is rapidly evolving. And so that value-based care toolkit, that's the newest solution we have, and that's something we just have a couple customers on it today because it's new in the market. And so we're looking for feedback. We want to hear from you what things are like on the ground, and we're always open to adjust and evolve our product to meet the market needs. And that's kind of our mission as a company, is we want to make sure that we're solving your needs today, but we also want to make sure that we're equipping you for the future of healthcare. So we want to essentially skate to where the puck is going in a proverbial sense.
I love that analogy.
Yeah. Lance, I figured you'd appreciate that.
Absolutely. Excellent. Well, thanks, Richard. I appreciate that. Time for some questions from our audience. I know we've got some. All right. So first question, for healthcare, how does your tool check for current deductible status?
Great. Well, thanks for the question, Daniel. So we have integrated Change Healthcare as our eligibility provider. And we also integrate with a practice's EHR practice management tool set. So we have access to that patient subscriber ID that's already been loaded into that patient. So what we're doing in real time is just pinging that subscriber ID to see where the patient lives against the deductible, or where they are against the deductible. And we can tailor that call to the specific events that patient is in for. So if you're a specialist and it's a specialist office visit, we can prioritize seeing that specialist specific deductible and or copay in that response. So that's one way we are kind of differentiated on the eligibility tool set, is we are very focused on getting the right eligibility response based on that patient, your practice, and what services they're receiving at your practice.
Okay, great answer. All right, any other questions? Oh, how is it priced?
So that's a great question as well, Daniel. So we primarily, it's a monthly subscription model based on the number of providers at your practice. The larger the group, typically you get some discounts as you move it into both the size of your practice and the more modules you adopt. The discounting also kicks in there. For that, the newest tool set we have, the value-based care tool set, which is primarily around adjudicating bundles. That actually is a transactional model, so it's a percentage of that transaction. But our first tools are subscription based.
Okay, terrific. I'll be patient this time and see if there are other questions coming in. I'm not seeing any other questions. 3, 2, 1. Richard, you're off the hook. Richard, thanks for your time today. Really appreciate your thorough answers. Really a pleasure. Before we leave for the day, we're going to have Mary come back. We did have a last question come up for Mary, and we'd like to have her answer that, if that's okay. Hi, Mary. Welcome back.
Thanks, Lance. Thanks so much.
Yeah, absolutely. So we have a question. Do you help report for MIPS?
Oh, great question, Julie. So the short answer is yes. And so it then gets extended into whether or not the specific measures that are patient-reported outcome related are the ones that you want to report on. So that is where we can help. We will collect on those measures. I have a list, Julie, if you want a list. I have several measures that we do comply with. And then also, when you need the data, Code has all of the export wizards built out already to follow the technical and the file requirements.
All right. Any additional questions for Mary before we let her go? All right. Well, there it is. Awesome. So thank you, Mary. Appreciate you coming back and being available. Yeah, absolutely. Well, everybody, thank you for your time today. For those of you on the call that are interested in learning about either of the sponsors, just ask you to go ahead and follow them on social media. Also, really hope that we see you at our Executive Healthcare Summit. Wanted to let you know that we do have a deadline for registration. It is September 8th. and we only have 8 more spots left. So if you really have been wanting to come up to the summit and you haven't gotten around to doing that yet, really encourage you to get that done. And then finally, we're going to do this again next week. Actually, we're going to do one more webinar on September 12th. And we look forward to seeing you all then. Thanks, everybody, for your time today. Have a great afternoon.